Hi, my name is John. In this episode of Healthcare Hacks, I spent a little bit of time explaining what the differences are between HRA, HSA, FSA, because there's a lot of confusion out there. So let's start with an HSA. This is a health savings account. You can only have a health savings account if you have a high deductible plan. But the idea is you put money into it, it's capped by the government, it's tax-free dollars that you can then use to pay for your deductible, your co-insurance, your copay, any out-of-pocket healthcare expense. There's other expenses like dental and vision, which you can also use your HSA dollars to cover. So that's an HSA. What's an FSA? Well, that is a healthcare flexible spending account. These are dollars you set aside, again, tax-free, that you can use to fund any healthcare expense as far as deductible, co-insurance, copay, or dental, vision, anything that's not covered by healthcare. Now, one thing you can't use either an HSA or an FSA for is for your premium. That has to be paid by a different source. The final one is HRA, or a health reimbursement account. This is probably the least familiar. A health reimbursement account is set up by your employer. You can't set it up, you can't fund it. It's money your employer puts in that allows you to pay for some of your healthcare costs. Now, you can use this dollars for premiums. You can use this also for copay, co-insurance. It's a pool of money that your employer gives to you that allows you to buy healthcare or pay for healthcare services with. Now, in many ways, all three accounts are similar, but there's also some key differences I want to talk about. So first off, they're all tax advantage. And what I mean by that is they're pre-tax dollars. That means when the money's put in there, you don't have to pay income tax on it. One big difference is rollover. So for a health savings account, you can roll over any amount that you have in it throughout time. That's your account. Whereas with an FSA and an HRA, usually they're capped. The caps are varied, but typically for an FSA, as an example, you cannot roll over more than $500. So it's kind of a use it or lose it with an FSA or HRA. You don't want to overfund them because if you do, you might lose that money. Another big difference is whose money is it? Well, in an HSA, it's your money. It's your family's money. It's your account. No matter what happens with your employment, no matter what happens to you, that money is yours. Whereas with an HRA or an FSA, it's really the employer's money. So if you leave in the middle of the year, that money's gone. So that's a really big difference that you have to think about as you make these choices. The other big thing with an HSA is you can invest it. You can invest in a bank, earn interest on it. You can actually use it like a 401k. You can put it in stock market. And you almost can treat it like a retirement account because when you turn 65, you can use it for anything. You don't have to use it for healthcare dollars. So if you have the choice, always choose the health savings account. If you have a question or there's a topic you want us to cover in the future, please email us at healthcarehacks@care11.com and we'll try to address it in a future episode.